And when I went back as an academic, I went back to the research to understand, what's happening during this postpartum period. And what I uncovered is a story that's really not being told, but everyone needs to hear. And, a lot of the story is one, when you become a mother, it's a huge developmental phase, and it's now being recognized as a neurocognitive developmental phase. And so there's a ton of brain changes that happen and brain power when it goes right.
Hi there, this is Samantha Saxby with another episode of Moms with Benefits. And today I am so excited to introduce Dr. Nikki Pensak. Dr. Nikki is the author of the book Rattled, but she's a lot more things too. So she's a clinical psychologist. She's a researcher specializing in treating postpartum mental health, anxiety, OCD, depression. She's certified in postpartum mental health and provides evidence-based therapy to her patients. She's a TEDx speaker. She received her PhD in clinical psychology from the University of Rhode Island. She's completed an internship and specialty training at Yale School of Medicine and a fellowship at the Massachusetts General Hospital / Harvard Medical School. So we are super, super delighted to have her on the Moms with Benefits podcast. So welcome.
Thanks for having me, Samantha. It's great to be here.
Awesome.
And
So
most importantly, I'm a mom of two.
yes, oh my gosh, I usually include that. I am so sorry that was a gap on my part. Mom of two.
I got to lead with the motherhood piece.
Yes, of course, of course. That's why we're all here. So what are their ages, boys or girls?
So I have one girl, she's almost 7 in a
Okay.
couple weeks, and then a boy, he's 4.5.
Oh, sweet. Okay. I am also a new mother. I still consider myself a new mother. It's been 15 months, but it still feels real
But you're
fresh.
in it.
I'm in it. I'm in the thick of
You're
it.
definitely in the thick of it. And you
Yeah,
have how many?
just one. Yeah, just one right now. So, yeah, yeah, it's been wonderful, wonderful transition, but a hard transition. And yeah, so yeah, I am looking forward to our conversation so it can directly apply to my life.
Yes, yes.
Awesome. So, okay, so you are a mom. Of course, we've talked to a lot of moms where, their transition into motherhood or their experiences into motherhood has inspired them in many different ways. And a lot of, moms have, found new careers, found new passions, figured out more of their purpose, aligning themselves with their values. And so all just wonderful stories, all unique to the moms in their specific journey. But I'd love, to hear from you. I'm assuming, you're this author of this book called Rattled. It's focused on helping moms during the postpartum period. And so what inspired you to write this? And I have a feeling it's something about your own experience. And so, just give us some more color into how this got started.
I mean, absolutely. It was a mix. So I spent my whole academic career working in medical centers and focusing on patients with very severe medical problems like coping with cancer. And then over time, I became fascinated with a different type of patient, the silent patient in the room, the caregiver. And so I built this program of research helping caregivers to take better care of their loved ones by focusing on their own mental health, managing their stress and anxiety and depression. So here I am, this expert researcher in caregivers, and fast forward, I become a mom, and I realized that mothers are really the ultimate caregiver. And I went through postpartum twice. The first time more mild, the second time very severe. My son was in the NICU. 2 weeks after he got out, we were on lockdown from COVID. And, I felt like, the ground was just coming out from under me. I was calling my doctor from my closet crying. And then basically what happened was a few months later, I found myself feeling better than ever and thriving after getting to the other side of postpartum. And when I went back as an academic, I went back to the research to understand, what's happening during this postpartum period. And what I uncovered is a story that's really not being told, but everyone needs to hear. And, a lot of the story is one, when you become a mother, it's a huge developmental phase, and it's now being recognized as a neurocognitive developmental phase. And so there's a ton of brain changes that happen and brain power when it goes right. But we do have a maternal mental health crisis. 1 in 5 mothers experience postpartum. And I just really wanted to destigmatize getting mental health treatment. I want to rebrand Mommy Brain so that everyone can understand the brilliance of the maternal brain and really help every mother feel the way I have been feeling since I got to the other side of what I thought was my darkest place.
So what happens to our brain?
So when you become a mother, your brain changes rapidly. It fine-tunes itself and primes itself for caring for your baby, right? So it's all this attention and neural networks being formed as you're learning new tasks and learning how to take care of the baby. And you're just wired to attend to the baby. It's the primary psychological preoccupation, right? It's all we think about. It's all consuming in the beginning, right? But there's a lot of brain changes going on there, and it actually sheds useless neural networks that don't have to do with taking care of the baby. Mm-hmm. And so that's where I think mothers need to understand that there's so much transformation going on in a very short period of time that when you're feeling overwhelmed and in the thick of it, understand that it's an adaptation, and your brain and you are just going, you're going through what some would consider similar to the phase of adolescence, just in a much shorter period of time. Your hormones change, there's biological changes, there's physiological changes, relationship changes, identity changes. I mean, what doesn't change when you become a mother? And so we really need to support mothers through this transformation, and everyone needs to understand and give it the attention that it deserves.
Yeah. So it's really, and there's this word for it, which I feel like is becoming more popular. But the matrescence, I think I'm saying that right. So like you said, it's like adolescence, but matrescence. Do you have any insight into, has this name been around for a while and we're just kind of just learning about it and just appreciating that transition into motherhood, is this big transition?
It's a huge transition. And I think that, now, researchers at Yale have now established that it's this developmental phase, matrescence. It has, been around, but it's not really gotten the attention. So I think the fact that we're having these conversations and understand, think about how much attention we give to adolescence and that journey. Mm-hmm. It feels like everyone understands what a complete upheaval that is. But now we're sort of giving that kind of attention to matrescence, and yeah. It is a similar developmental phase.
So you used the term mommy brain, mom brain, which I feel like I'm guilty of using too. How do you feel about kind of that term and related to the actual transition that moms are going through? Like, is the mommy being reflective of those neuroplasticity kind of things that you say we're cutting off to focus on the baby? Like, is that an interchangeable kind of theme or way to put a wrapper around it? Do you know what I'm asking?
Yeah, I want to clarify that the mommy brain stigma is attached to feeling foggy and forgetful, losing track in a conversation, not remembering, what you did yesterday. And that is, the subjective experience is very real. So mothers experience what we know as the typical mommy brain stigma. Mm-hmm. That happens. However, when we look at the research and actually look at cognitive functioning and memory functioning, when we compare mothers to non-mothers, there's actually weak support for significant differences. And most likely that feeling of mommy brain, the fogginess, forgetfulness, is due to the increased mental load and the lack of sleep. But understand that your actual brain is not performing worse than non-mothers, right? So I think that And in fact, the recent research is showing actual cognitive boosts. And so we want to give the full picture of mommy brain, right? It's not just, the feeling foggy and forgetful. That's not really backed by science much, but it's also potentially incredible cognitive changes that work for you and how to nurture these processes along the way.
That's fascinating. That's fascinating. So, do
Yeah.
you have some more examples to give on what this latest research says, are the benefits or some of the positives about this mom
Absolutely.
brain? Yeah.
Yeah, I mean, I always say that becoming a mother is a natural employee development program. I mean, we're seeing improvements in skills that we value in our employees and our workplace culture and in our society as well. So, increased empathy, increased
Mm.
mental flexibility, increased abilities to problem solve, increased resiliency in the face of very real stress. And so, think about it. I mean, getting your toddler and your baby out the door at the same time to get to a doctor's appointment, that requires leadership and problem solving and a lot of planning. And, you're doing that in real time very, very quickly, right? Think about the 100 things you need for the diaper bag. I mean, it's just incredible how much mothers are really actually using their brains and doing so much. And I think that we as mothers need to feel empowered to understand exactly how much we're doing when it doesn't seem to the, observer that we're potentially not doing a lot, or mothers don't give themselves enough credit for what they're actually doing.
Yeah, it's really interesting. My mind goes to a lot of the challenges feel very emotional. And so, do you have any color to give of maybe some of the most common emotional challenges that new mothers face?
I mean, the most common one I hear, well, there's several, but mom guilt is a big one.
Mm,
I hear a lot about baby bonding and how mothers feel like they're doing it wrong if they're not enjoying motherhood as much as they thought they would, or, they're not having that ideal image of bonding to their baby right when their baby comes out and they're like in love and immersed with that. It's like, I know when I went through it, I knew I loved my baby, right?
mhm.
But I was like, is this how it's supposed to feel? Like I thought that I was like supposed to be like absolutely consumed with this love and bubbly, but it was such a stressful time in the newborn phase. And so I think we have to validate that actual baby bonding for the most part, for a lot of
Mhm.
women, mothers and caregivers, it actually takes months, and that's okay. That's a typical process.
Yeah, I appreciate you sharing that. I know when my son was born, they put him on my chest, and then they had given me a warning, but he was a preemie, 4 weeks early, that they were probably gonna have to take him because of his lungs. And so I think I got 45 seconds with him, and then they were like, "We gotta go." And so I think I like put up this like wall that he's safe, he's in a good place, but I think that affected my ability to bond right away too. And so I know there's every mom's birth story is different, and so it's hard to kind of go in with a certain expectation, and then your birth story, your postpartum story, NICU stays, everything is just so different and can affect everybody so differently. And so I don't know, would you say, do you have anything to share to moms that might be listening that may be struggling with maybe they're not ideal postpartum experience right now?
Oh, of course. I mean, every mother has a story about how it doesn't meet that ideal. I think we need to get rid of that vision, that expectation of this ideal image of what motherhood looks like, of what those first months look like. And I think we're getting better at it. But to understand the realities of how much everything is changing and how much we're doing, how overwhelming it is, on lack of sleep. I mean, this is not typically ideal. And I think when we build it up and have those expectations, we can be disappointed. And so to have a realistic expectation that it's wonderful and it's incredibly challenging. And things happen, like you said, NICU stays, postpartum happens. And it doesn't mean that something's wrong with you or that you're doing it wrong. It's actually quite typical. And more mothers, I recommend to really prioritize their mental health, because a lot of mothers I see are suffering more than they need to, but they kind of just thought that this was how, this is part of it, right? And I'm like, no, you actually could benefit from some treatment. And
Yeah.
but mothers are afraid of reporting their symptoms because they're afraid that they'll be viewed as unfit or not a good mom. And I really want to break that stigma. And even if you're not experiencing postpartum, there's so many changes going on. Why not have an objective someone on your team, on your, in your village that you can talk to about all of this? Yeah.
Yeah, I hear you on, moms not necessarily feeling like they're allowed to express, these types of emotions. Do you have any insight into kind of the timeline associated with postpartum? Not necessarily to say that like postpartum exists at X amount of weeks or X months or whatever, but I think there is, I have heard from my personal circle that postpartum challenges 10 months out, 12 months out, 14 months out feel like they are not validated, because it's like, well, I've been doing it for a year now. And so I should have my stuff together. And so can you share any kind of thoughts or experience that comes to mind in the work and the conversations with the moms that you've had?
Well, you're exactly right. And I hear that all the time. And I would say, and I talk about this in the book, I interviewed a lot of top researchers in the field, and we were talking about how that 1 year cutoff, right, or
Mhm.
is arbitrary. Even the 2 year cutoff is arbitrary, right? So you can really have postpartum, up to even further out of 2 years. So it just depends. So we tend to see two peaks in postpartum, and one is sort of right away if mom chooses not to or doesn't breastfeed because of the hormonal changes. So breastfeeding is somewhat protective in terms of mental health for a lot of moms.
Mm.
Sometimes that's not the case, but I will say for a lot.
Protective, what do you mean by that?
So, the hormones dip more when you're not breastfeeding. It's a more abrupt change, right?
Okay,
And so that can make postpartum happen if you
gotcha.
breastfeed, right?
So there's some research to back up where if a mother stops breastfeeding or pumping, I'm kind of lumping that in there
Yes.
too, then your
Yep.
body's not producing milk anymore, and so it tends to, plummet the hormones and make you feel more lows. Is that a safe way to? Okay.
Exactly. So, because there's a lot about oxytocin that happens. That's like a feel good hormone that's happening when you breastfeed. Okay. And so
Mm,
you're not getting that amongst other hormonal changes and changes in neurotransmitters. And so we just typically we see it early on if you don't breastfeed, or when you start to wean, right?
mm,
Or stop. Right. And this is
mhm.
why we always tell mothers, you definitely want to wean gradually. It's helpful, to know that you could have postpartum come on at that time as well. Um, Baby blues last, less than 2 weeks. So if you're feeling bad, if you're feeling off even, before, after 2 weeks, right? It's not
Really?
baby blues anymore. Yeah,
Wow.
baby blues is limited, to the first 2 weeks. It should be over by then. So if you're feeling off, this is why I say
Wow.
really like I'm advocating for a more proactive postpartum mental health um, focus, because I think that mothers don't need one more thing to do. And so I don't want mothers really self-diagnosing. I
Mm,
think that mothers, if they feel off, they should schedule an appointment with their provider and let the doctors do their jobs. We want to take care of you. We'll assess you. And I actually recommend in the beginning, when you're thinking about starting a family or when you're pregnant, once you pee on that stick, this is what I say, start thinking about your mental health appointments, because it allows you to find a provider that you trust, that you want to work with. Sometimes it can take months to get an appointment, but they can get a
mhm.
good baseline assessment of you. And they can also explain to you your personal risk factors for potential for experiencing postpartum. And for example, if I have a patient with a history of your bipolar disorder or strong family history, I'm going to want to check in with that patient early on because they're actually at greater risk for postpartum psychosis, even though that's rare. I'm not trying to scare anyone. I'm just saying that, mental health should be a part of this because happy mommy, happy baby. And I do think that becoming a mother is the time to really dig deeper into taking care of yourself more. All of these changes are happening to help you take care of the baby. I'm trying to align while your brain is in this transition of taking care of the baby to also take care of yourself alongside that.
So that reminds me of when I went to my 6-week appointment and I shared with my doctor that I was feeling sad. I feel like maybe it's postpartum. And so their first reaction was like a look of sadness, but quickly followed by like, oh, why didn't you call us? And in my mind, I'm thinking, why didn't you call me? Like, well, I don't know. Like, I think I had enough to do. I was not thinking clear to be like, I need to call them right now because this is what I'm feeling, And so I feel like I fully support if what you're chasing is a more structured setup to be able to support moms in a more proactive way, because when it's put back on the mom to say, well, why didn't you call me? It's like, well, I was a little busy trying to figure out how to like survive every day.
I mean, that's almost like mom shame right there. And that's a terrible message in terms of how the provider responded. And I'm sure it was well intentioned and they just wanted to be like, oh my gosh, we could have helped you sooner.
Yeah,
that's where they came
totally.
from. I can hear, a sort of shaming message like, oh, okay. Here's the thing, yes, I think in decades we will get to that streamlined, automatic postpartum mental health care team where it's like, you go in and you have that as part of your OB visits and whatnot. But right now, unfortunately, the onus still falls on mothers to sort of advocate for their own mental health and to make the appointments, find the provider, show up to their providers. And so, so that's why, and it doesn't have to be your OB. I think it should be someone that I always say, you want to get a therapist or prescriber or that specializes in postpartum mental health so that they know what they're looking at.
Yeah. Yeah, all great points. I think we have a long road to go, but I hear you very much in that the onus is still on the mothers today. And so educating, spreading the word, even that, a word like matrescence, which I still think I'm saying it wrong, is out there.
Okay, I said it wrong for a long time.
Matrescence. Oh my gosh.
Adolescence,
Matrescence. Thank you. I will still probably say it wrong, but I will keep practicing.
Okay, I actually didn't even, sometimes I avoid saying it in interviews because it just throws everything off. It's not like a good sounding word.
You know what? I agree. And so part of me is like, okay, it's clearly not mainstream enough if enough of us that are interested in the topic still can't remember how to say it. So we got to say it more, shout it from the rooftops.
Yeah.
So, can you tell us more about the central themes in your book of Rattled? It's called Rattled. And so tell us more about the central themes and kind of why you chose those central themes.
Yeah, so it's called Rattled, How to Calm New Mom Anxiety with the Power of the Postpartum Brain. And it really is a roadmap to postpartum up to several years out. So it's meant for parents and primary caregivers, mothers, as to really understand what happens. So I start off in the beginning of the book. There are 3 parts. The first part focuses on what happens when you become a mother developmentally, the brain changes and the biological changes, as well as developmental. And then I go into a little bit of postpartum mental health care planning that's proactive. And then the reason I did that very strategically, because the thing is that if you don't have your mental health intact, you can't really get to the next levels of the book or make use
Mhm.
of the strategies I provide in the other parts of the book, because you're not going to be able to think at higher levels, right? And so this is why I really push postpartum mental health care and making that a priority early on. It helps everyone, the mom, the baby, the partner, the whole family. Um, so that's where I start. And then sort of the middle of the book is how to handle the new emotional experiences. Things like mom guilt, mom shame, mom rage, right? Relationship changes and how to prep your marriage, as well as back to work transitions and baby bonding. And then the third part of the book, which is really to help mothers thrive. It's sort of like once we get through mental health, then these emotional experiences, then we can take it that much further to get to a place of thriving. And there is where I talk about the neuroplastic changes and how to take them further, as you become a mother and engage with your babies, as well as post-traumatic growth. A lot of mothers we know 13% of mothers experience birth trauma, but every mom I talk to really has some sort of story where it was really challenging at some point, or there was something that wasn't expected that really affected them. And so when we think about becoming a mother, we call it a normative trauma, because everything in your body, your whole system, everything just changes so abruptly. So, so every mom experiences this like normative trauma. And so that's where I talk about, the growth and resiliency that can come out of all of these changes if you take them further. And so that's the last part of the book.
Normative trauma. That's not a word I've heard before. Where did that come from?
Actually, this professor at Yale coined that term. He called it a normative trauma. And it really stuck with me after I heard that, because I was like, yeah, it's a normative experience when you become a mother. We've been doing this since the beginning of time. However, it is such a abrupt change to every system, just like a trauma is. A trauma kind of stops you in your tracks and changes everything. However, we know that in a third of patients that experience trauma, they're going to experience post-traumatic growth. And I really want to bring more mothers to the other side of trauma, even if it's not trauma in the traditional sense that it's like a bad thing or something that would cause symptoms of post-traumatic stress disorder. But it is sort of, think of it as just incredible, profound change, seismic changes into you and your life. And so that's where that comes from, right? And it's an opportunity. It's really an opportunity. I think of becoming a mother as an opportunity for growth and development. And what greater motivator is there than your kid? Because you want to be the best version of yourself for that baby. And so I'm really trying to just help mothers feel like they're thriving. I think a lot of mothers are suffering unnecessarily.
Yeah, and it feels like I don't think I've ever talked to a mother who doesn't want to be the best for her kids. And so the question in the resources today are centered around how. And so tackling your mental health feels like a big, big part of that how.
Right. Exactly. But it's also, it's so much more than just mental health. It's like everything. And so I think that we have, I talk about the mom brain stigma and turning that on its head. And so mothers can feel empowered that they're an asset to themselves, to the workforce, to society, with all of these enhanced skills that they're developing, even if they're not working, right? I
Hmm.
get a lot of moms nervous going back to work. They're like, I haven't really been doing anything. And I'm like, actually, you've been doing so much. Your brain just went through an incredible development program. And so, and then I list out, the benefits of becoming a mother and what happens. And so that's really important. And I also, I made the reason I also wanted to write this book is because when I was working in academia, I would publish in these academic journals, but I know nobody's reading them, right? But I really wanted to get the science out to the mothers and the people that need it most in our society. So I translated all of the science to the layperson, and I also tell my personal story to make it more engaging and understand that, like, hey, I went through this too, even though I'm an
Hmm.
expert, it happened to me. So if it happened to me, I think it could happen to anyone, being an expert in treating mental health. And so I didn't know a lot of this before I became a mother. And so I assume a lot of mothers don't know this as well. And with all of the noise on social media, everyone has a voice. I really just wanted to parse down what's really important and effective and backed by science.
Yeah, that's amazing and incredible work that you've done, and I'm so grateful that you've done the work to make this available to moms. So, getting close on time here, but you mentioned one more question I have. You mentioned mom rage a
Yeah.
little bit ago. Do you have any insight on mom rage?
Oh, absolutely. I have a whole chapter on mom rage.
Ah, okay. Give
And
us the keynotes.
I have some very specific strategies on how to manage mom rage.
Mm,
But it is a very real experience that mothers have due to we now think it's due to like hormone changes and also the increased mental load and being overwhelmed. And so it is a common experience. And I call it's very different than the experience of like mom shame and mom guilt. Mom rage is like this intense anger, rage. You're ragey. You're like go from 0 to 100. Like you're
mhm,
triggered. And so my golden rule for mom rage is actually don't make it worse. Because there are a lot of
mm.
things we do when we're in that mom rage brain, right? We take the bait, we fight with our partner. How can you not? We yell at our kids, right? And so I really provide a good framework for how to slow it down, not make it worse, ride it out. And there are a lot of things that moms are doing during this period that actually work against them. So I give some insight into that as well.
Amazing, amazing. This feels like just really an all-encompassing book that any new mom, even a mom that has kids,
Yeah.
not new, because they're always coming up against new mom challenges. So,
Mhm.
really, really thankful that you're doing the work that you're doing, and that we can help get the word out. So.
Yeah, thank you.
Is there anything else you'd like to share before we wrap up today?
Well, definitely check out Rattled. It's sold wherever books are sold, Amazon, Barnes and Nobles. Support your local bookstores. And if you do read it, please leave a review. I love hearing from people. I get random emails from people, and I'm so excited when I hear their feedback and what has helped them, or not. Or not. I'm open to that too. So feel free to let me know. And also follow me at Dr. Nikki Pensak because I still have some book tour events coming up for the next probably 8 months,
Oh, awesome.
as well as other resources that I provide for moms. So yeah,
Awesome. All right. Yes. Again, the name is Rattled, and that's Dr. Nikki Pensak. So thank you so much.
thanks for having me.